Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurophysician from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. My email is 3klpm@gmail.com. Today we are going to talk about a very interesting topic, the examination of eye movements, especially pertaining to double vision. The examination of eye movements. Cranial nerves part 29, ocular motor nerves part 15. Examination of eye movements. Assessment of ocular movements should include an assessment of visual acuity. When acuity is impaired, the patient may not be able to adequately fixate, and therefore we should always test visual acuity. When acuity is impaired, the patient may not be able to adequately fixate. Assuming reasonable visual acuity and normal head position, the motility examination begins with an assessment of fixation. A normal patient can fixate steadily on an object of regard. Inability to maintain normal steady fixation may occur because of square wave jerks and other disorders of ocular movement. The 6 cardinal positions, easily remembered by the letter H, are designed to search for dysfunction of individual muscles or nerves as well as supranuclear abnormalities of gaze. So the 6 cardinal positions using the letter H are designed to search for dysfunction of individual muscles. So let's see how we can use the letter H in examining all eye movements. So we draw a letter H and describe the movements. So at the extreme medial part is the medial rectus. At the extreme medial part is the medial rectus. So above that is inferior oblique and below that is superior oblique. Note that the action of obliques is opposite to their names. Inferior oblique, the movement will be upwards, whereas superior oblique, the movement will be downwards because the way they are attached to the orbit. So medially is medial rectus, medially above is inferior oblique, medially below is superior oblique. Then we go laterally. Laterally is lateral rectus, and above in the lateral direction is the superior rectus, below in the lateral direction is the inferior rectus. So laterally is the lateral rectus, above laterally is the superior rectus, below laterally is the inferior rectus. So if we use this letter H, we can find out all the 6 cardinal positions of the 6 different eye muscles. So medially is the medial rectus, above is inferior oblique, below is superior oblique. Laterally is the lateral rectus, above is superior rectus and below is inferior rectus. The muscles which move eye upwards are inferior oblique and superior rectus. The muscles which move the eye downwards are superior oblique and inferior rectus. The muscles which move eye medially is the medial rectus. The muscle which move eye laterally is the lateral rectus. So if we have this broad overview of the eye muscle testing, especially using the letter H, examination of eye movements becomes easy. Pursuit versions are done by asking the patient to follow a target held about 0.5 to 1 meter away, such as the examiner's finger. So you can keep the examiner's finger and ask him to follow the finger. These following movements are known as pursuit movements. So you can keep a finger or a pen and ask the patient to follow the movement, follow the finger or the pen, that becomes pursuit movement. Pursuit movements are the following movements. The image, the object which stimulates the pursuit movement is a moving object. A moving object is the stimulus for initiating the pursuit movement. So it should be a moving object. For example, you go and watch a nice shuttlecock match being played between 2 international stars. You look the shuttlecock moving from one side to the other side. These are also pursuit movements. So for pursuit movement, the stimulation is a moving object, not a stationary object. Very important point. Then comes the vergent system. The vergent system comes into play when an object moves towards or away from the observer. The vergent system comes into play when an object moves towards or away from the observer. The central mechanisms subserving adduction of the eyes for convergence are different from the mechanism of adduction during conjugate gaze. So for convergence, we have a separate center. That is very, very important. Another important eye movement is the saccadic system. The saccadic system can be tested by having the patient rapidly refixate between the two targets. For example, I am looking at the camera, someone knocks at the door, I immediately turn my head to the opposite side. So the refixate is the rapid refixation between the two targets is the saccadic movement. That is the fast movement. It is initiated from the front light fields area number 8, goes down, crosses over to the opposite side and goes to the PPRF, paramedian pontine reticular formation, which is responsible for all horizontal eye movements, be it saccade or pursuit. PPRF pulls eyes towards its direction by involving the lateral rectors of the same side and MLF medial rectors on the opposite side. So the saccadic system is a fast movement, whereas pursuit movement is a slow following movement. For pursuit movement to be initiated, the stimulus is a moving object. For saccadic system, it is a fast, rapid fixation between the two targets. Pursuit movements are usually originated from the parieto-occipital cortex, goes to the PPRF on the same side, whereas the saccadic pathway or the movements are initiated from the front eye fields area number 8 on the opposite side, goes to the PPRF. So these are all the important eye movements and we need to examine them. So these are all the important concepts of examination of eye movements. I hope you have enjoyed listening to the lecture. Most of the concepts of neurology I have put it in a book called as Focused Neurology, written by me, put it in a question and answer format, which will be very, very useful. It is available online from all leading booksellers, including Amazon. So if interested, it could be bought online. I hope you have enjoyed listening to my lecture. If you have enjoyed it, please like it and share the link. But please subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, and my web page, Dr. Sreenivas Concepts. Thank you. Bye.